So my name is Sayyida Taiba, and I am a 2024 graduate from Dow Medical College. I'm currently serving as president of Student Interest Group in Neurology at DMC chapter. And today we are hosting our fourth episode for Road to Neurology series. This will be over our YouTube channel, and we have our amazing guest today, Dr. Edward Yu from Zucker School of Medicine. And Dr. Yu, can you please introduce yourself briefly?
Sure. I'm Dr. Yu. I'm one of the neuromuscular specialists here at Northwell Health. Do you want some background, or where I did my training and all that stuff? Or
Yeah, sure.
okay, sure. So I'm originally from New York City. I grew up in New York City. Did my undergrad in Massachusetts. Went out to Chicago for medical school, and then came back to New York City. Did my residency at North Shore LIJ. Which is now Northwell, and did my fellowship in neuromuscular training at Mount Sinai School of Medicine. So I've been here at Staten Island for the last, I'd say, 15 years or so, and I've been the program director here for the last 6 years.
Right, amazing. Thank you so much, Dr. Yu, for taking our time today for our audience and for this episode. So we will be beginning with the question series. My first question about this episode would be, that when you see applications, neurology candidates application for match, what is something that clicks you, or what is something that really makes you interested in interviewing that candidate that you see in either their personal statement or in their CV that candidates should know more and should mention more? What are some of the things that clicks you and you send the invitation for interview?
So, we get tons of applications. I think, since COVID and switching to virtual interviews, I think all the programs in the United States have really received a flood of applications. And I think going through all these applications, I think the ones that really stand out are the ones that really shows initiative. So for example, if you write in your personal statement that, you're interested in this, not necessarily neurologic topic, but something that kind of interested you, and you demonstrate that you actually showed initiative and came with a plan to address that interest, I think those are the ones that really stand out.
All right, that's an amazing answer. Thank you so much for that. So my next question would be, on opposite side, on the flip side, if you notice something on CV or personal statement that makes you think that this thing is a red flag or a deal breaker, and I would not want to interview such candidates, what would these things be?
So I think the basic stuff, right? So basic grammar, basic spelling, right? If you see something like that, even if the content of the essay is really good or excellent, if you see these little mistakes, then it kind of shows a little bit of sloppiness. And I think that may not necessarily be a deal breaker, but that definitely puts us a little bit more hesitant, because, applying to residency is a pretty big deal, right? And if you're spending all this time and money and energy into applying, just checking your boxes, double checking your spelling, double checking your grammar, I think that goes a long way of showing us that okay, at minimum you should have that amount of a concern regarding your application. So.
All right, that makes so much sense. So my next question would be that there are a lot of things that program directors say we see when we are evaluating a CV, which includes the scores, volunteership, leadership, and research. So how do you and your program personally balance all of these things while evaluating the candidates?
So I think most institutions have a basic cutoff as far as scores. We try to approach the application review in a holistic approach, trying to look at various different elements of the candidate. So most candidates will have pretty good scores, right? You're all kind of in that middle of that bell curve. The outliers we do spend a little bit more time on as far as trying to figure out, okay, is there something that's beyond the scores that would make us offer them an interview, or get to try to evaluate their application a little bit in more depth. But I think scores is one thing, right? And then, of course, the personal statements is really where you can kind of shine and kind of stand out. Because the CVs are, in general, most of the CVs are going to be relatively equivalent. You'll have some leadership positions, you'll have some, assigned chapter involvement. You may do a little bit of research here and there. But I think that personal statement is where you really can kind of show what is unique about your application or about your life experience, actually. And I think that's really what we're looking for in the personal statement is your life experience, not necessarily a rehash of all of the things on your CV, but those elements in your CV that kind of reflect what you want to say about your person and your life up to this point.
All right, that makes a lot of sense. And my next question would be related to the personal statement, that how can one make personal statement stand out without overcomplicating it or without using the complex words? How can they make their personal statement stand out?
So this is something that I tell high school students also who are interested in medicine, is that medicine is really the best physicians are the ones who communicate very well, right? So, and that includes writing. So if you are a good writer, then you're probably going to be a good communicator, which will probably make you a good physician, right? Because a lot of it is really kind of talking with patients and kind of figuring out what the patient is trying to say. So I think good writing goes a long way, right? And the best personal statements that I've read are the ones that not necessarily have the most content, but is able to convey their message in a direct and effective and efficient way. It's not 2 pages long, right? If you go beyond 1 page, we start to lose interest, right? So conciseness and efficiency, I think those go a long way with, and shows that you're an effective communicator also. And I think going back to what I was saying about the CV and about the initiatives, picking those elements out that demonstrate your initiative from your CV, and then, don't list every single research project that you've had, because I can see that on your CV. I don't need you to tell me that in your personal statement. Your personal statement is what makes you a person, right? So I think that's the take-home message I would have for people writing their personal statements.
That was a great advice. Thank you so much for that. Okay, so my next question would be, what are some of the common mistakes that you commonly usually see on ERA CV, and how candidates can avoid those mistakes? Sometimes people are unknowingly mentioning stuff or saying that I did that or I did something. So what are some of the things that you usually observe during the math cycle on ERA CV?
So if you put something on your CV, be prepared to talk about it, right? Even if it's the smallest little thing. If you say your hobby is horseback riding, and I see that, and I ask you on the interview, oh, what is your experience horseback riding? You give me a blank stare. That to me already means something, right? You don't put stuff on your CV unless you're prepared to talk about it. So if you're the 5th author on a research project, right? If you put that on your CV, be prepared to talk about it, right? And we've had interviewers who come to me and say, hey, I'm an expert in this field. This person said that they did this project. They had nothing, they don't know what they're talking about. That does not look good at the end of the day, when we start looking at our applicants, our interviewees, right? So be prepared to talk about everything, little thing that you list on your CV, okay? The other thing I would say is, again, try to put those things on your CV that are relevant, right? If you start putting all, what you did in junior high school or elementary school, that's not going to be relevant. But if, for example, you worked in a restaurant for like 5 years trying to support your family while you're studying, that should go on your CV, because then you can tie that into your personal statement, right? So again, all that stuff is, when we talk about a holistic review, that's what we're looking for, is we're trying to get the sense of what that person is, right? And it doesn't have to be like 20 research projects, right?
Right. These were amazing points, and I hope audience will take points from these. Okay, so my next question would be related to the interview. What are some of the qualities that you look for in candidates while you are interviewing them, and what are some of the common mistakes that candidates made during the interview, and that they should be avoiding those mistakes?
Sure. So I think because all of our interviews are in a virtual environment and they're all done remotely, I think camera angle is a big thing. So making sure that your screen is positioned right below your camera, so that way you look like you're actually talking to the person. Okay. Again, don't use AI. Don't use a cheat sheet. We do enough of these. We do at least about 80 to 90 interviews a year. And then that's just the resident interviews. I'm not even talking about medical school interviews, right? So we have a lot of experience interviewing, and all of our interviewers have a lot of experience. So we know when a candidate is reading off the screen, we're using AI to do something, right? So that's why, again, if you do that, and hopefully none of you guys do, it's okay to use AI to practice. It's okay to take notes, but if you do it in an interview, we usually pick it up. Okay, and these are these little red flags that you want to kind of be careful of. Okay. The other thing is really try not to, some applicants are very nervous, which is understandable, and we understand that too. Okay. But if it's, but again, you should have at least some practice with interviews, right? Because it's not just residency, right? You interview for medical school, you've interviewed patients, right? So you should have a certain comfort level as far as communicating, and try to be succinct if you can. Try not to kind of run on with answers to questions, and kind of gauge what the interviewer is doing, right? If the interviewer is kind of like looking away and like not paying attention, maybe you're not holding their interest, right? So just basic interviewing skills.
Right. These were amazing points. I'll be moving forward. Can you please, Dr. Yu, can you please tell us a little bit about Zucker School of Medicine and how is the residency program there? What are some of the opportunities, academic or clinical, that residents can get? And what are some of the fellowship options that they can apply for? Or in general, how is the program and what should be the candidates know before applying, or if they are interested in Zucker School of Medicine?
So we are a relatively new program. So we're in currently our 6th year. We've graduated 2 classes so far. All of our residents or all of our graduates have moved on to fellowship, and they're all doing very well. So I'm glad to see them kind of progress. We are part of a larger system. So we're part of the Zucker School of Medicine, which is part of Northwell Health. We have about 23 hospitals in our system, so it's a pretty big system. It's actually the largest system in New York State, and one of the largest systems in the country and in the United States. So we have a lot of resources. I think the benefit of our program is that we are a pretty small program. We only have 6 residents a year for a total of 18. So we still have that kind of small residency community feel, but with the resources of a large institution. The Zucker School of Medicine is actually a highly rated medical school in the United States. It's a new school, so it was only founded in 2004, but they've done a fantastic job, getting recruits and building the program. So I think now I think we are in the top 25, if not even in the top 10. So from the resident side of things, we get a lot of faculty education on how to teach and how to manage medical education from the Zucker School of Medicine. So that's another resource that we can really rely on. So from that angle, we were able to kind of build up the program. I think the unique part of our program is because it's such a small community feel. I think our residents are really the main driving force of success for our program. They work really well together. If you talk to any of the rotators or students that rotate through our program, it's palpable how much they enjoy working with each other. So I think that's really the key point in our program. And then the second point I would make is that we designed this program in 2019, right? So it's not like we have 50 years of history behind us. And when we designed the program, the main focus is really education. So it wasn't to, staff the hospital, it wasn't to fill in the blanks for patient care. It's really more to educate our residents and make them excellent neurologists. So that's been our kind of guiding mission from the beginning, and we continually try to kind of reimagine what that could be and what that looks like.
All right, that makes a lot of sense. And one of the questions that we have been receiving from our student chapter and other international medical graduates is that how your program support or maybe welcomes or sees IMGs, because there are some programs where IMGs are not that welcomed, and there are some programs that are more oriented towards taking IMGs. So about your program, is it like IMG friendly or is it like not so IMG friendly?
So I think it's it's a tricky question because when you say IMG, you're talking about the entire globe, right? You're talking about the entire world. So I think the so we take an holistic approach to applicants, right? So that means looking at the whole candidate, right? That also means, kind of figuring out, okay, what is this candidate's background? What is their training? What are resources are available to them, right? So if a candidate is coming from Africa, they're going to have different resources than a candidate coming from London, right? So we do a pretty holistic approach to looking at the candidate as a whole. I think the main separating force, and I think one of the huge disadvantages for international medical graduates is the U.S. clinical experience, right? Because if you don't have a lot of U.S. clinical experience, as a program director, my worry is, are you going to be able to hit the ground running and be integrated into the medical system quickly? And we have had plenty of excellent international medical graduates in our program. So I would say that we are friendly to international medical graduates. I think it's an important resource, an important pool of candidates for us and for the country as a whole. I think you guys bring a certain different perspective and an attitude of hard work, which we really appreciate. So I don't think that it's a disadvantage, but I think getting that clinical experience under your belt, because a lot of programs will only interview IMGs with clinical experience, and having that kind of block and knowing what the U.S. system looks like. I think that's invaluable when you're applying.
Absolutely. I 100% agree with you because when I came from Pakistan here in US for my clinical experience, I noticed a huge difference. The advanced system, equipments, and everything is like a lot different, and there was a lot to learn. So definitely you need to learn first before applying so that you go well with the residents. So that was thank you so much for answering that. There's just few more questions. Okay, so if students and applicants do ask if they want to contact your program during the application, after the application submission, during the interview season, or after the interview season, do you and your program appreciate the thank you emails or the letter of interest or any emails like that, or not?
So I don't think it hurts. I think it's it's always nice to get an email, okay, especially a thank you email. But I think what you want to avoid is being too overbearing, right? So if you send 20 follow-up emails, that's too much, right? But if you had a good experience, and also try to be genuine, like if you had a good experience on the interview and you had a great time talking with the interviewers, then by all means, just send them a quick email. We're not robots, right? We're not algorithmic, right? We're all human beings, and if you have a good conversation, just say so, right? So I think that's really what it comes down to.
All right. So my last question would be, not last, second last question would be, what is your advice for those applicants who went unmatched last year and are reapplying this time? So what would be your one advice for them?
So that's a tricky question. I think part of it is kind of re-examining your application and say, okay, from an objective perspective, what about my application is lacking? What might have been a red flag for interviews? Was it a problem getting an interview, or was it a problem during the interview? Right, those are two very different things. I think one resource would be to ask your mentors. If you have a mentor, say, hey, I didn't match this year. What do you think is going on? If you have a mentor that's a program director or an associate program director, even better, right? Then you can say, okay, well, what are some of the things that, basically, stood out that prevented from matching? And I think that's my best advice. Just identify those areas that you may not be as you might have been blindsided by, and then try to address those issues. Right? If it's an interview issue, then practice interviewing. It's like anything else. If you practice it, then you'll get better at it. If it's a application issue, that's a little bit more difficult to kind of figure out, right? Um, if you're lacking in U.S. clinical experience, well, try to get more clinical experience, and that way you can kind of demonstrate that you're showing initiative, and you're also getting that experience under your belt, so that the next application cycle you look much stronger.
All right, these were the great advices. And lastly, what would be your advice for overall all of the neurology candidates and the candidates who will be seeing us this episode, and especially the members of student interest group in neurology at Dow Medical College? So, what would be your advice in general for all of the applicants for this year?
I think the always go back to why you want to do neurology and why you want to be a physician in the first place. Because I don't know if this is a international medical graduate issue or just applicants in general, but sometimes what we want to see as a program director is, what is your genuine interest, not just in neurology but in taking care of patients, right? Are you going to be compassionate? Are you going to sacrifice your time to help patients and to better them? And I think that a lot of that comes through during the interview, right? So once you get through that first phase where you get the interview, you pass the application process and you get your interviews, that's where you really want to kind of think to yourself, why did I want to go into medicine in the first place? And why do I want to go into neurology specifically? Oftentimes, in the United States, we have a whole undergraduate system where you have to go through undergraduate training and then go through medical school, and then really be committed to the whole process. I think in Pakistan, you guys start a lot earlier than the students in the U.S. So for us, it's like, okay, well, how does this 24-year-old know that they want to do medicine, right? And I think that's something that you kind of want to really show to the interviewers, the dedication and why you want to do it. And I think if you remember that going into an interview, then I think that comes out during the interview process.
All right, that makes a lot of sense. Now we are at the end of our episode. Thank you so much, Dr. Yu, for taking our time to do this and for sharing amazing insight on this whole topic. And this will be really, really helpful for all of our group and for all of the candidates watching across the globe. So we are ending our episode 4, and we will see you all again in episode 5 for this podcast. Thank you so much, everyone. Stay tuned. Goodbye.
Great. Thank you.
Thank you, Dr. Yu.